Yes. So someone said, what is the correct design? There's a lot of different epidemiological designs and studies here, and some of them on the left-hand side are observational studies, and some of them on the right-hand side here are intervention studies where we might be allocating our exposure, we might be introducing things to a population in order to be able to assess the effect. If we look on the observational side, we might then have some studies where we are just looking at descriptive analysis. And that descriptive analysis might be data from groups, in which case we would describe those groups and we describe the proportion or the prevalence of mental health conditions in those groups. Of course, once we've described those groups, we may also want to go along to analyze the risk factors for that. And of course, that is going to be, I think it's always important to describe your data to begin with, and then to go on and do some more analytic analysis there. So I would say that distinction between descriptive and analytic is going to be a little bit false. I think we can do both, but we've collected the data that enables us to do both the descriptive and the analytic data. That is not only for our groups, where we might have ecological which compare and describe those groups, but also in terms of individuals, the description of the conditions, the outcomes that we have in our individuals. But we should be able to also go on to do some analytic some analysis of those and show the risk factors that are affecting the outcome that we have there. So observational studies, we don't do anything in the with the population that we're looking at. We just observe and we record our outcomes there. On the other hand, on the other side of this picture, there is the interventions trials, where we might allocate an exposure, we might allocate an intervention, and we say some people receive this intervention and some people don't, or some people receive this treatment and some people receive a different treatment. And those intervention trials are also important in that some of them can be individually randomized, whereby people are individually randomized from the one arm of the trial. And of course, that happens in many cases where there is a treatment or a drug or a vaccine which is available for people. As they say here, data from groups, or we might have community trials or cluster randomized trials where we randomize clusters to receive a particular intervention. And that happens for a number of different reasons as well. And so this is the sort of a brief overview of epidemiological studies, which can be used not just for mental health research, but for many other research studies as well. Okay.